Very good evening to you. Thank you very much for joining us here on Solihull Radio. It is hashtag Radio GP podcast evening this evening, and we thank you for either listening live or downloading this featured content podcast. You can obviously get involved with us here in our discussion. Dr Oliver Denton from Daleswood Health over there in Boston has joined us as our Radio GP this evening. We've got three topics that we're going to be talking about over the duration of these episodes, and if you want to get involved with a question, you're more than welcome to do so using the usual methods. You can send us a text 075 64 30 30 64. You can send us an email, studio@solihullradio.com, or if you would like to speak with Dr Denton, 0121 70 40 185. Good evening, Doctor. How are you?
Evening, Jeff. I will make my apologies now. I have an annoying cough picked up from my children, no doubt. So if I have to run away from the microphone and cough, I apologise in advance. But I'm very well otherwise. Good
too. It's great to see you again here in the studio. Thank you for giving up your time and coming into the radio station.
It's a pleasure. Thanks for having me.
Right, there's a couple of things that I'd like to talk about as we go through this podcast today. Yep. The first thing that I'd like to, or the first topic rather, that I'd like to focus on is what's happening for March for Men in relation to our prostates.
So March for Men, there are lots of awareness weeks, months, days throughout the year. March for Men is one to try and increase awareness specifically of prostate disease and prostate cancer. I know we were talking about just before we came on about different types of prostate disease. And from a doctor's point of view, we call those benign, i.e. they're not a cancer, or malignant, they are a cancer. Of course, we should all be aware of prostate cancer. It's cancer that only men can get because only men have prostates. Hence the March for Men, or Men for March, Awareness Month. So, it's really trying to make what is essentially quite a silent disease much more aware. So men who tend to be less eager or keen or confident or just bothered to speak up about problems they might have, encourage them to do that.
You know, the sort of visual image we have when people talk about prostate of the rubber glove and the examination methods, yep. And having to go into the doctor's surgery and talk about your waterworks is not necessarily top of the list, is it?
No, it's embarrassing sometimes, and you often put it back as I can just deal with it, or I have had a bit of a problem with my stream, or I've had a little bit of blood, or I'm having some problems getting an erection. All of those things can be quite embarrassing, and often for men, either they don't want to speak up about it, or they just have other things that they're dealing with. And
another thing is that problems with prostate, it focuses in the later stages of life, doesn't it? Towards sort of 40s, 50s upwards. Yeah. And the guys that are those sort of ages come from a time where you just got on with things.
To a certain extent. There are always the exceptions. Prostate cancer can affect any man. Of any age, but of course the older you get, the more likely it is to be a problem. So it's really important from a doctor's point of view to not just dismiss a potentially life-changing disease because you're young. And we've all, as GPs, been utterly shocked by seeing people in their 20s, 30s, sometimes teenagers, with diseases that you would only expect in advanced age. But yes, you're quite right. The older men get, the much more likely they are to develop prostate cancer or any other prostate disease. I like to think of prostates a bit like ears. Our ears grow as we get older. We all see those old grandpas with big ears. And our prostates do exactly the same. But not every man's got massive ears. So it's the same with your prostate. And the bigger your prostate, the more likely there is for something to potentially go wrong in it.
Okay, the first medical question I'd like to ask is, can you just take the thing out?
You can. It has a function, of course. It's an organ with a role. And one of the treatments available for prostate cancer is a prostatectomy. So that is the removal of your prostate.
Right.
There are several different ways of doing that. Now, the sort of mainstream method is laparoscopically, i.e. keyhole surgery, with or without a robot. That just helps to improve visualization and get around the prostate, because, of course, you're trying to deal with a 3D structure in a recess of your pelvis, so it's hard to get to. But yes, having your prostate removed is certainly one option, much like removing any other cancer. If a lady had ovarian cancer, you'd remove the ovaries. If you had testicular cancer, you'd remove the testicle, the breast, etc. So yes, you can, but there are problems with it, and that's why men, if they are presented with a choice, men are presented with a choice and should be presented with a choice as to how their prostate cancer is managed, based on numerous things: how aggressive it is, how extensive it is, whether it has spread, whether it's confined, and their age. Is it
a cancer that develops relatively slowly, or is it, stage 1 straight to stage 4 and...
It really depends on how aggressive it is.
Right.
You can have a very aggressive prostate cancer that progresses very quickly and rapidly moves on to, as you mentioned, stage 4. So not just locally advanced, but has metastasized, which means that it has spread beyond just the locality.
Okay.
So yes, you can get very aggressive prostate cancers that do that. Equally, the majority, well, I should say not equally, but the majority of prostate cancers don't tend to be aggressive, and tend to be sort of slower onset, with a sort of more predictable pathway. Okay,
so let's give you a chance to have a cough and a slurp of water there, but let's take it to the other end. So let's say somebody presents to you, and you've done some tests, and it is not a malignancy. They've come with, let's say, an enlarged prostate. Where do you take that? Is that treatable with medication and, a lifestyle change, or will it shrink back? Because from my research, it's the size of a walnut, and, how big can it get, sort of thing?
Well, the first thing to say is it's really hard for any doctor to really rule out prostate cancer.
Oh, right.
There isn't a simple test.
Oh, okay.
It's not just a matter of going and having a blood test or a scan or biopsies to prove or disprove whether it's prostate cancer. It's elusive and it's difficult to find. To prove that you have a cancer, we need tissue, so we need to find it. But often trying to get the right bit of tissue is very difficult. It's a bit like trying to get the needle in a haystack. So proving or disproving prostate cancer isn't a simple matter of blood test or scan or examination. But you can be quite confident in terms of if you do have an enlarged prostate. And a lot of men, just as I was talking about the ears, will develop benign prostatic hyperplasia, which is the posh name for a large prostate. So benign, it's not cancerous, and the hyperplasia just means it's grown. And yes, it can get really quite big. When you're feeling a prostate, yes, it's a bit bigger than a walnut, and it can become much bigger than a pear.
Wow.
So it can be really quite large when you feel a prostate. And the problem with that is that the prostate's a bit like a donut, the ones with the ring in the middle. If you pump up the ring, the hole in the middle gets narrower and narrower and narrower. So it becomes harder for you to pass water. And of course, it's less reactive, so it's harder to open up and it's harder to close. So typically, the symptoms that you'd expect in a man with BPH, benign prostatic hyperplasia, is that they will struggle to go to the loo, so they'll feel they need to go. They'll stand there and wait for a while, and eventually their stream will come, and it won't be the same good flow that they've had. It's more of a trickle. And then when they've finished, they'll dribble afterwards. And because it's less reactive and they're less able to empty the bladder, they often find that they have to go more often as well. So you're passing smaller volumes more frequently, and also you tend to pass more at night as well for the same reasons. So
you're up in the night a few times. And is Is there a more of a sudden onset sometimes as well, or is it a case of standing there and waiting, or is it can it be either side of the coin?
Usually BPH is gradually progressive. So you start off with a few minimal symptoms, you dismiss them, and it becomes more and more of a problem, so it creeps up on you. But as with all things in the body, we can have a threshold where we've coped. All of a sudden, you can't cope any longer. And it's not unusual for some men to present in what we call retention, which is simply where the pressure's built up so much that they can't actually open the prostate anymore, and they've got a huge balloon or a huge bladder full of urine, and it's incredibly painful. So sometimes men with BPH present in retention, or with other symptoms like water infections, and normally chaps don't get water infections. So any man presenting with a water infection, you've got to wonder, is there something going on beyond just this being a water infection?
Okay. Taking it to the other area of my research before we started our podcast today, what happens if there's a bacterial infection? It becomes inflamed, swollen, and I'm afraid I'm not very good at pronouncing the word, so you're going to have to help me there.
Prostatitis.
Thank you. So I'm just thinking from a men point of view, prostate cancer,
yep,
prostatitis,
yep,
and an enlarged prostate. I understand the role of the prostate,
yep,
and I can see three different injuries there that would effectively give you the same symptom.
Potentially, although there's usually differences in terms of time of onset, nature of the symptoms, and often pain. Excuse me. Prostatitis is uncomfortable, is the first thing to say.
Okay.
It is not nice to have prostatitis. For any woman that's had cystitis, it's not comfortable. And prostatitis is equally uncomfortable. If I examine a large prostate, it should not be unpleasant. It should, I mean, of course, it's uncomfortable, just the nature of that examination, but it shouldn't be painful. If I'm examining a prostate cancer, it shouldn't be painful. But if I'm examining prostatitis, it's going to be uncomfortable. It feels unpleasant, or at least that's my experience of examining patients with prostatitis.
Okay.
Equally, there are different causes. You've mentioned infections. We tend to have a bit of a watershed. So younger men, we worry more about sexually transmitted infections causing prostatitis, and older men, we tend to worry more about prostatic disease, BPH. But it can happen just because. I mean, the prostate itself acts as a sort of channel. So you have obviously your urethra coming through the prostate from your bladder to the outside world. But also you have your seminal ducts as well. So you have your testicles, which plumb into your seminal vesicles, which produce the semen, and then they feed through the prostate into your urethra, so that when you ejaculate, you have the ejaculate coming out of the penis. So it all has to plumb in, and that works through the prostate. So you mentioned sort of having your prostate out. Well, if you have your prostate out, you can never ejaculate after that. It's just not possible. And that's a sort of simple fact. You've just removed all of that mechanism for plumbing those bits in.
Okay.
But the issue with prostatitis is that bacteria travel back up the penis, and then rather than going into the bladder and causing cystitis, go into the prostate and cause prostatitis. And that's the acute prostatitis. You can get chronic prostatitis as well. So that's a inflammation within the prostate that goes on for a long period of time. And that's often quite complicated to treat. Prostatitis is difficult to treat in all cases because it's not a very good or receptive organ for antibiotics.
Right.
So you often have to have quite high doses for quite a long period of time. And the problems with that are that it can often fall into being chronic. So you end up with a long-term pain or discomfort within the prostate.
Okay, so fellas out there, just from my research, and I'm in no way a medical professional, pain during ejaculation, pain during urination, and also pain in that whole region.
Yeah.
It is a painful thing.
Yeah, it's unpleasant.
Right. Okay.
And that's my experience of prostatitis, is it tends to be unpleasant. It can also be associated with problems within the testicles as well. So you can get inflammation of the testicles, either the epididymis, which are the collecting tubes, or the testis itself, the orchid, and that's called epididymorchitis.
Wow.
Yeah,
you're good at this. Brilliant.
But yes, it can be associated with that, or recurrent water infections, but it's just part of that same tract that has become inflamed or infected for whatever reason.
Have you seen a growth in just the ability to talk about men's health over the last, let's say 5 years? Has men's health now become part of the forefront? Because I've definitely noticed men's mental health, due to the sort of media coverage and celebrity coverage of people actually talking about it. But things like prostate, other typical men-only sort of injuries and diseases, have you seen an increase?
Yeah, definitely men speaking up about it.
Yeah.
In the off, yeah, absolutely. I mean, traditionally it was a question that you'd have to broach to start that topic. But now I think I see a lot more men that are prepared to. And I think these awareness weeks, awareness months, awareness days are really vital for encouraging men to think about that. There are some initiatives that aren't necessarily that effective in terms of measuring PSA, for example. It's not a brilliant test for assessing prostate cancer,
right?
But if it's the key to unlocking men talking about it and being more aware about their symptoms, then I would embrace that. But as a test on its own, it can cause a lot of confusion. It can cause false reassurance. And that's something to be very wary of. Just because you have a normal or low PSA does not mean you don't have a prostate cancer. And equally, just because you have a high PSA doesn't mean you have a prostate cancer. In fact, one of the most common reasons you're going to have a high PSA is because you have got prostatitis or you have got an enlarged prostate. The bigger the volume of your prostate, the higher your PSA will be. And there is a ratio that you really need to sort of measure up there between how big your prostate is and what your PSA is. If you've got a massive PSA and a massive prostate, it's not so much of a worry. When I say massive, sort of double figures.
Sure.
And really, we want PSAs to be low. If it gets above sort of 3.5, 4, depending on your age, your GP is going to have a little flag raised and go, okay, we should probably look into this a little bit more.
Okay.
As far as PSA testing on the NHS, every man is entitled to have a PSA check over the age of 50. It's not a screening program. There is no evidence to suggest that testing PSA is of any benefit to the population at all. It doesn't increase how long you're going to live. It doesn't increase your life expectancy if we test your PSA. So from that point of view, it's a bit of a rubbish test.
It sounds it.
To that end,
yeah.
But it's a useful tool if actually it's the key to getting men to engage with their health more. But please don't think it's the answer, because it's definitely not. So
having your PSA blood test is not the oracle.
Nope.
It is the beginning of the journey.
Yep.
And it will just highlight to your medical professionals where they may need to take your treatment or for some additional information.
Yeah. I'd say I'm just as guilty in some circumstances of not examining the prostate. And you can talk yourself in and out of having a prostate examination. It's useful, just as it would be to have a breast examination if you're worried about breast cancer. But you can only feel about a third, at most half of the prostate, just from where it is. So you're only feeling a third to a half of the organ anyway. So how can you reassure someone? But if you feel something abnormal, then that's absolutely something you need to follow up on. So prostate examinations, really important, and they form part of that assessment. The PSA also forms part of that assessment, but the history as well. So it's really important to learn more about the individual and whether they've had any other symptoms. And then lastly, it's about imaging. It's about having a look at the prostate gland. And just, I keep on drawing analogies with breast cancer, but we use ultrasound, we use mammograms, we use biopsies, we use examination, and we take a detailed history, particularly a family history, and it's the same with the prostate. We use PSA blood tests, we use examination of the prostate, we use MRI scan much more now, and that's definitely the gold standard assessment if you've got concerns regarding your prostate, for assessing whether there is a prostate cancer or where it is, and potentially guiding where your biopsy is. And that's where you go in with a needle and take a little bit of tissue out.
Wow. Much more complex than I first thought. To finish on our prostate section of today's podcast, locally within Solihull, on the 27th of April, from 9:30 in the morning until 12:30 at the Shirley Methodist Church on the Stratford Road, the Shirley Lions are running a prostate testing event, effectively a blood test for PSA to get your journey started. Like we say, it's not 100% reliable, but it is the starting point. And it's been held in conjunction with the Worcestershire Prostate Awareness Group and being funded by Shirley Lions themselves.
I think it's a brilliant initiative and one that I'd encourage all men, if they're concerned or just simply want to know more about it. There'll be people there that have experienced prostate cancer, have been through that journey, and will be able to tell you their mistakes, the things that they've learnt along the way. So I think it's a very worthy and important thing to increase awareness and improve men's understanding of what is a very common illness and disease that men will almost always develop as they get older.
Okay.